one's halfway gone, and it's barely even open. There's a hole in the bottle, leaking all this wine. It's already empty. Thank God somewhere it's fine. Hey, no, I don't miss out. In fact, it slipped my mind. There's a hole in the bottle of wine. You may ask me where it's going, but I can't even find the hole in the bottle of wine. Cheers.
Pictures on her phone, tears in her eyes. Waterproof makeup ain't made for a breakup. On Saturday night, then it's hey, how you been? Good, how about you? Funny how seeing you once after a few months gets you like that. Right back to telling folks you know I know all about some new guy taking you out. Then you unfollow me, then follow me back just so I know you're still around. Some girls get their mama on the phone, take a trip back home, pretend they never knew the guy. Some girls drink a bottle of wine, got a note, extra text to get them through the getting by. Sometimes it's a clean break, stay gone, clean slate, moving on to something new. Sometimes some girls make it easy on you, some girls never do. Some hearts stay broke, some hearts don't skip a beat. Some people say goodbye, then try to make it alright just like you're doing to me. But tonight I'm letting it rain. Some girls get their mama on the phone, take a trip back home, pretend they never knew the guy. Some girls drink a bottle of wine, got a note, extra text to get them through the getting by. Sometimes it's a clean break, stay gone, clean slate, moving on to something new. Sometimes some girls make it easy on you, some girls never do. No, some girls never do. Yeah, some girls know when they've got something worth holding on to, but some girls never do. Some girls get their mama on the phone, take a trip back home, pretend they never knew the guy. Some girls drink a bottle of wine, got an old extra text to get them through the getting by. Sometimes it's a clean break, stay gone, clean slate, moving on to something new. Sometimes some girls make it easy on you, some girls never do. Yeah, some girls never do. Sometimes some girls make it easy on you, some girls never do. Lipstick on the bottle that you left next to my bed. The makeup on my pillow reminds me you were there. Try to tell my friends what you do, but it's too hard to describe, 'cause everything about you is better in real life. Get up out of my head, get up out of my mind. So come and fall into my arms and let me hold you tonight. You got my heart in your hands and it just feels right. So come and fall into my arms and let me hold you tonight. Let me hold you. Let me hold you tonight. Yeah, when it's late and I'm lonely and I've had a few drinks, it's your head a lot stronger.
Test 1 2. Hey folks, if you're at the tents right now, the stream will be starting in here in about 1 minute. Peggy's going to do her presentation on Skymed. So if you're watching right now online or at one of the field tents, the audio and everything's working perfectly this morning. So thanks for Bob and Gary for helping us get that all worked out. We'll start here in just a minute.
Take my time, get up out of my head, get
Well, good morning, everyone. Thank you so much for coming. I have no way of knowing who's in the tents, but welcome there as well. If you are in one of the tents and you're not able to pick up any of the information, so please stop by the booth. And folks just coming in the door, if you'll grab a clipboard out of that little bucket right there, that's got some information for you. So if you're watching from one of the tents, please come by the booth in the vendor section, number 4 out there, and let me know that you watched this presentation so that I can get you your free raffle tickets, because everybody's going to get 3 raffle tickets for being here today. Well, my name is Peggy Shafer. I am with Skymed. I've been with Skymed now for 8 years, and I travel the country. I'm also a full-time RVer, and I travel the country spreading the word about medical evacuation and what this membership is able to do for you to give you some peace of mind and also protect your family as well as your finances. Now, Skymed is a company that has been around now for 30 years. We have a very big membership in the RV community, and it's because so many have seen the benefits that this membership can do for them. However, a Skymed membership covers you both while you're traveling and while you're at home, so you don't have to be on the road to take advantage of this membership. In our 30 years in business, we have never had any kind of a regulatory complaint against us, never a lawsuit. If you look us up on the BBB, you will see that we have an A+ rating and 0 complaints on file. That's pretty impressive for a company that's had over 350,000 members in its base. Our headquarters are in Scottsdale, Arizona, but we also have an office in Lakeland, Florida, and we have 2 in the United States Virgin Islands. One thing a little unique for a company these days is when you call Skymed, when you call our 800 number because you need us, you never get one of those annoying touch-tone, push 5 for a heart attack, push 6 for a stroke. You get a real live person who answers the phone in English in the United States of America. Folks, do you want to grab a clipboard from the bucket there before you sit down? That would be great. Okay. I mean, how many companies are left like that where you don't get a push 1 for this, push 6 for that? And I don't know about you, but I always get lost and end up hanging up and calling again because I pushed something wrong or didn't push it soon enough. I'm going to start with telling you a real life story about how this membership works when you need it. And this is a story from Rich and Judy Haffey. They are RVers, and they have a fifth wheel. And they were out in Yellowstone. They do some work camping part of the year. And while they were in Yellowstone, Rick started having chest pains. And late in the evening, they didn't go away, but they waited till the next day because he thought, well, maybe he didn't know what it was. The next morning, his wife took him over to the clinic because there is no hospital in Yellowstone. And they ran some tests, and they thought he had signs of a heart attack, and they said, we need to get a helicopter in here and get you to a hospital because we don't have any facilities here to treat you. Well, as they were Skymed members, Judy picked up the phone and called Skymed, and within a minute, she said within about 90 seconds, the transport was authorized to get him to East Idaho Medical Center. Now, Rich said he had the most beautiful ride in a helicopter over Yellowstone. Unfortunately, he wished it would have been under better circumstances. And he got there, and they ran some more tests, and lucky for him, it turned out it wasn't a heart attack. It was a gallbladder issue of some kind that mimicked those symptoms, and he was able to be treated and ended up being released. But that helicopter transport, what do you think that cost? It was a 50-minute ride. Let's hear some guesses. What do you think it cost? It's on the screen. I know you can cheat. $54,000. That's an incredible amount of money. And had they not had their Skymed membership, he said he never even saw a bill because Skymed took care of it. And they actually told me their story in tears because they said that, they didn't have that kind of money. They didn't have insurance that would have covered it. They said that might have been the end of their RVing right there, to have that kind of a bill that you're stuck with. So why do you need Skymed? Well, one of the reasons is the kind of things that happen to Rick and Judy. None of us plan medical emergencies. We never know when they're going to happen. And you don't know if you're going to have an accident or an illness. And in this country, there is an ever-growing gap in the amount that your insurance covers for these services, for a ground ambulance ride or a medical helicopter or an air ambulance, and what is charged. Most of the stories that I hear from people who've had to have a helicopter or an air ambulance ride, the bills that they have been stuck with after insurance have been in the $30,000 to $50,000 range. That's just pretty typical. In fact, NBC had a segment, I don't have a clip of that, but they actually said they did a study that showed that over 70% of Americans are severely underfunded for any kind of medical air transport. Over 70%. So that's a really high percentage that are not going to be covered for this kind of thing. So the big question becomes, how much will you owe? ABC News did do a segment on the high cost of this, and I'm going to play it was a 10-minute segment, but I'm going to play just 3 minutes of it for you.
Millions of Americans are rushed to the hospital every year, 400,000 of them transported by emergency helicopter. Many times it's a life or death flight where every second counts. But the service often comes with a sky-high price tag. Tonight, ABC's chief investigative correspondent, Brian Ross, examines the big business of air ambulances.
You're talking about very critically injured patients, traumas, strokes, heart attacks.
Emergency workers call it the golden hour, the crucial 60 minutes to get medical care for a patient facing death.
Failure to get them to the care probably means that they aren't going to survive.
That urgent need to beat the golden hour clock has spawned a nationwide fleet of helicopter ambulances, saving countless lives. But our Nightline investigation, conducted with ABC stations across the country, also found it has left many of the very people it saved facing financial turmoil, with bills as high as $40,000 or $50,000 for a short flight.
Would you call this price gouging?
Well, some of it is. There's no question that some of it is.
Behind those heartwarming stories of life saved is a hard-edged air ambulance industry, free to set any price it wants.
Takes advantage of people at a very vulnerable moment.
Warren Larson of Owensboro, Kentucky, a helicopter pilot himself, says he was stunned at the cost of the quick flight for his daughter after she was injured in a serious off-road ATV accident. $47,000 for 79 miles. After insurance and a failed negotiation, he still owes $36,000.
It's definitely going to cripple us financially.
He is not alone. With our ABC teams across the country, we found hundreds of families.
I'm worried to death about it. It's very stressful worrying about it.
Being sued.
I don't have the money to give them, so my wife and my son and myself don't want to be homeless.
Or hounded by debt collectors.
I look, I see the number, I'm like, I know who it is, I don't even want to talk to them.
Over huge bills their insurance won't fully cover.
I feel like I can never dig out.
Some forced into bankruptcy, one after another. Patients told us how they felt they had been taken for a ride in more ways than one.
I wasn't asked if I wanted to go on the helicopter. I didn't think I was hurt that bad.
91-year-old Warren Lowe and his wife Ethel were on their way to church in Virginia when an uninsured driver slammed into their minivan.
911, where's your emergency?
Car wreck here on 89. Several people hurt.
Lowe's leg was shattered, and doctors at his local hospital wanted him sent to a trauma center 55 miles away.
Didn't nobody tell me nothing. They just took me and put me in the helicopter and gone.
The cost, $47,000 for a 20-minute helicopter ride.
I couldn't believe it when I looked at it. $47,000, that's ridiculous.
Well, I think you'd probably agree. I know I do. And sometimes people ask, well, why are these flights so expensive? And the reason that I've heard given is that, first of all, a medical helicopter is a little over $13 million to purchase and equip. Then they have to have staff standing by 24 hours a day, because when they're called, they have to go right now. And so even though the cost of a single flight is not that much to the company, that's what they say they have to charge. You know, I don't know. I'm certainly not defending it. A ground ambulance, the average ground ambulance now in the United States is $2,500 per ride. Last month, someone told me during the pandemic here that they had to be transported to the hospital. This person had recovered now from coronavirus, and they said what they said was a relatively short ground ambulance ride. After Medicare and insurance, they still had to pay $1,738. That's a lot, I think, for a ground ambulance. We've talked about the high cost of the medical helicopters. And by the way, Skymed does not own any equipment. We just make sure that you don't end up with a bill. So with this membership on a 911 call, you don't need any pre-authorization. You just call 911 like you normally would. And if you let Skymed know after the fact, if the paramedics order in a helicopter, that's going to be covered with this membership without a pre-approval from a 911 call. Another consideration, both where you live and when you're out RVing, is how far are you from a level 1 trauma center? The farther you are, the more the cost the transport is going to be to get there, because most things are billed by the mile. So what exactly can a Skymed membership do for you? And what makes us different from some of the other plans out there. You know, there's many medical evacuation, what I'll call assist plans. You get them in the mail, everything from FMCA to Good Sam Travel Assist, NRA, sometimes credit cards advertise that they have medical evacuation. Well, first of all, one of the big differences is that we cover you starting with that 911 call. Other companies simply do not. When you read the fine print, and I never did this until I got involved with Skymed, but now I have a health insurance license. And when you read the fine print, the other plans will generally say they're good for hospital to hospital emergency transport, medically necessary. And they also will say that they're good from the hospital you're taken from to the next closest appropriate medical facility. Okay. It's not a take you home plan. Skymed has a take you home guarantee that even if the hospital you're taken to can treat you in the event of any critical illness or injury, you, the member, can say, I want to go home. And we will take you back to your home hospital. You have to let that soak in for a little and think about, and I know nobody likes to think about these things. You don't like to think about what ifs. But the what if you're 200 or 400 miles from home or 1,000 miles from home, and you land in the hospital, and now you find out you're going to have a serious surgery or an extended treatment of some kind where you're unable to just get up, walk out of that hospital, and drive home without having this done. Ask yourself, where would you want to be in this situation? If you're okay being where you are there at that hospital, great. But if you want to be back home at your home hospital with your network of family support and possibly a big difference in insurance if you've been taken to an out-of-network hospital, that can make a big difference as well of what your bottom line is going to be. This is where Skymed comes in to get you back home. The closest appropriate medical facility, this gets even more important if you're out of the country. How many here take cruises aside from a pandemic when you can cruise or have taken cruises in the past? Quite a few of you, okay. Have you ever read some of those stories about somebody that got sick, or you've seen the ambulance pull up to the ship and take somebody off and you really don't know what happened? Well, you know, with many of those plans, those assistance plans, or even the cruise line insurance, when they say closest appropriate medical facility, if they deem that hospital in San Juan, Puerto Rico, or St. Martin is medically adequate to treat your issue, they're not going to take you anywhere. That's where you're going to be stuck. So again, that take you home guarantee can get very, very important. Every once in a while, my clicker decides to take a nap. So you're covered for the ground helicopter, or the ground ambulance, medical flight for light helicopter, hospital-to-hospital air ambulance, and there is where we are going to ask that you call us so we can authorize it first. One of the reasons being, if you've been taken to a hospital that can't treat you and they want to move you to the next closest appropriate medical facility, if this is something that you could be transported back home for then, or you want to be transported home, we would want to do it right away then, if it was medically safe for you to be flown. So then we're not moving you twice. It just makes more sense. Besides the medical transport, there are 15 other Skymed benefits as well, and those are listed in the brochure. But some of them are, if we take you back home and you're out in your RV, we're also going to take your truck, trailer, truck, fifth wheeler, whatever you have with you, we'll return it all the way home for you. We'll get a licensed bonded driver to return it. We pay all the fuel. Or if you prefer having a family member or somebody that you trust drive it back, we will pay their expenses to fly them in. We'll pay all the fuel again to get it back home, and incidental expenses for them along the way for RV parks and things as well. If you use a bonded driver, they will not sleep in your RV. Okay, all they do is drive it. We return your pets, cats and dogs, that is. Okay, so we will return those back home. We return the family, your spouse or companion that's with you on your family plan. If you have, our definition of family is your children up through the age of 24, as long as they remain full-time students, and grandchildren are covered up until the age of 18, anytime they are traveling with you without their parents. They're covered under your Skymed plan. Primary driver disability, that's one of our most frequently used benefits. It does not require hospitalization. How many here do not drive the truck and fifth wheel or trailer? Oh, I see some hands going up now. Okay. Okay. So this kicks in if your primary driver gets a diagnosis or a condition where he's not going to be able to drive, or he or she, for 10 days or more. In this case, it could be an eye injury, a broken leg or something, or you just can't drive. We will then either return your equipment home for you and get you home as well, or if you want to continue the trip but you just need to move, we will get you to your next destination. That's an option as well. And I believe that is one of our more frequently used benefits. Visitor transport. Skymed will fly in a family member to your bedside. If you're not going to be transported back home, we will transport someone to you immediately. No waiting period whatsoever. And again, a lot of the assist plans read that you have to be in the hospital 7 days or more. Or if your spouse is there already, then that you're not considered alone. None of that applies with Skymed. Skymed doesn't, they feel you probably need that support, so we will fly in a family member just to be there for you. Return of remains, that's something we never want to think about. But if someone does pass away along the road traveling, or if you're on a cruise or something, Skymed will ship remains anywhere the family wants them sent to. So altogether, there are 18 different benefits. And our take-you-home guarantee is actually good in a 32-country area. It's all the United States, all of Canada, all of Mexico, and all of the Caribbean, where you might take a cruise to. It's kind of the zone where an air ambulance can get you back home in one movement, is where the take-you-home, guarantee without medical necessity falls in. Now, what happens when you travel beyond that? If you take a trip to Europe or Australia, well, then it switches over to our global plan, and that covers you in almost all of the rest of the world. And I say almost because we do not cover war zones, okay? Now, every week, somebody asks me, is Chicago and Detroit still covered? But yes, they are. Most of our overseas repatriations are a little bit slower because, again, it's probably not going to be by air ambulance. You may be in the hospital a little bit longer overseas until you can be stabilized. And most of them are done by first-class air with a first-class commercial air with a medical escort. A 19th benefit that's not in the brochure is we have a full-service travel division called Skymed Travel that I'm also a part of. That's actually my background, is tour and travel. I've been doing that for about 40 years now. And on Sunday, I'll actually, at 1 o'clock, I'm going to do a presentation here on cruising Alaska. It's going to have some beautiful photographs and some great deals for 2021 cruising to Alaska. So that one's going to be about 45 minutes. I hope that some of you can come for that. It'll be fun. This is another couple that were vacationing in St. Martin. Fell and broke their hip. Again, they didn't want to be stuck in the hospital there for hip surgery, and Skymed flew them back all the way to their home hospital very quickly to have this taken care of. So people are so appreciative and so thankful when they need this membership that they actually had made the decision to go ahead and join. Skymed is a lifetime guaranteed renewal system. There is a one-time qualification to join Skymed. It's an easy one-page form that we'll talk about in a few minutes. You would think it would be very expensive, but I think it's very reasonable for everything that you get. It's less than $1 per person per day to be a member of Skymed. You're never dropped because of age or because you used us or because of a condition that you develop. As long as you keep your Skymed membership active, then it's a guaranteed renewal. We have 3 different plans. They all have the same inclusions. It's just a matter of how you want to pay for them. So we have an ongoing monthly. That is the only one that has an application fee. The ongoing monthly is for a family, $59 a month and a one-time $75 fee. We ask that you keep that for 2 years, but you can keep it for as long as you want. I have people that have been on this plan for 8 years. And again, it's going to be all 18 services that are included in that. For an individual, that plan is $45 a month. Then we have a 3-year, and the 3 and the 5-year, you'll see they have the same exclusions, but you're just going to save a little bit by purchasing a longer term plan. So our family 3-year rally price is $16.95 for the 3 years, and the 5-year is $24.95. So using the 5-year as an example, if you're a couple, it basically breaks down to about $500 a year. No co-pays, no deductibles, no claim forms. It's just a phone call to use this membership. It's so easy. We have a special for during this rally that I've never had the opportunity to offer before in my 8 years. They've done this never, as far as I know, that if you sign up during the rally, you're going to get an extra 6 months free on that 5-year membership. And if someone here at the rally is a member and refers you, they also get 6 months free. If you join today and go and talk to your neighbors and they decide to join, have them put your name down, you're going to get an extra 6 months free. So actually the 5-year price is 5.5 years during the rally. It's one payment on a credit card for all 5 years, or the 3-year, you would get an extra 3 months right now. We also have a thank you for your service program that we've implemented, and we're calling that our red, white, and blue program. If you are or were ever in the military, a frontline healthcare worker, or law enforcement, paramedics, firefighters, those type of things, anything that would be considered the red, white, and blue, we'll add an extra 3 months onto that 6 months. So you'd actually get 5 years and 9 months when you sign up. You are guaranteed a renewal at the end of 3 or 5 years at that same price that you're paying today. And also, the 5-year is a willable asset. So if something should happen to one of you during the 5 years, your spouse or companion will inherit extra time on their membership. If something should happen to both of you, you can name someone to inherit your Skymed membership. Okay? We have a 30-day, 100% money-back guarantee. I always suggest to people, fill out the application, get the membership started and in place and the protection, and then think about it or compare other plans that you have if you want to go that route. If you decide in the first 30 days you don't want to keep it, Skymed will refund everything that you paid. One of the reasons that I recommend you not wait is because, like we said, medical emergencies and accidents, they're unplanned. You don't know when they're going to happen. And Roger Moraes is a gentleman and his fiance that I signed up several years ago at a rally. The very next day, he was T-boned in an accident riding his motorcycle. So in less than 24 hours after he had joined Skymed, he ended up using his membership. They were so thankful that they had enrolled that day prior. You'll see there's a very easy one-page form in there. And towards the top, I just want to point a couple things out about the form. It asks for medical pre-existing conditions because we don't charge anything extra for pre-existing conditions. Everyone pays the same rate when they join Skymed. But all you need to write on there is anything that you've been seen or treated for in the last 6 months. And prescription meds only, not dosages or anything, or just what they're for, but prescription meds. If you need a transport in the first 90 days or a service that is directly related to one of those pre-existing, Skymed reserves the right not to cover it in that first 90 days. Starting day 91, all of those pre-existings are covered and always will be, and there's never again any other waiting period for anything you develop. We actually had to do this because some people started to try to sign up for Skymed from the back of an ambulance. So that's where this came about. Now, that doesn't mean you don't have coverage for 90 days. You're covered for accidents, injuries, anything, anything else. And I'm not saying necessarily it's an automatic denial either. They look at everything on an individual case. Any questions? Yes. Yes, you're full-timers. She asked, what do I put for my transport city if I'm a full-timer? Ask yourself the question, if I have a critical illness or injury and I want to be taken somewhere, where is that going to be? A lot of times it may be where you are from, it may be where your kids are, somewhere where you'd have more family support or help. That's what you write down for. Her question is, once I write it down, basically, can I change it? Yes, you can change it. You can. She asked, could I change it when I need it? The general rule of thumb is if where you're being taken is a less distance than what's on the form, they'll usually okay that. Okay. That's a great question. Any others? I didn't see, did she come in and give you the 3 raffle tickets? No. Okay. We'll get those for you. And we're going to have to clear out the room, I know, so we'll finish this up for now. I will be out at the table afterwards, or I can speak to any of you outside if you have individual questions. But actually, is she still sitting at the table there? Okay. She'll probably, just on your way out, just stop and get, she knows she has to give you all 3 tickets, okay? And, I'll collect those forms. Thank you so much. Please keep the pens and the materials. I'll just take the forms and the clipboards back.
Hey, folks, if you're still here and you're looking for honor flag coins, I do have coins up here for the honor flag. If you want any coins, stop by and make sure you get your raffle tickets before you guys leave.
Solid gold country 33 on my